Today we are looking at diabetes, symptoms and complications. Diabetes affects many different body systems and causes several symptoms, including excessive hunger and thirst, dry mouth, increased urination, tiredness, unexplained weight loss, headaches, vision changes, poor healing of sores, vaginal infections, impotence, weight gain, numbness or tingling of the extremities, and itchy skin can also be associated with diabetes. Blood sugar levels are controlled by hormone insulin, which is produced and secreted by the pancreas. Those with increased body fat are at a higher risk for type 2 diabetes. The risk is greatest for those with excess fat carried around the waist. These people are also at increased risk for hypertension, high cholesterol levels, and heart diseases compared with those who are lean or carry fats around the hips. Prediabetes has been referred to as impaired glucose tolerance and is thought to be an early potentially reversible stage of type 2 diabetes. Diabetes can cause damages to many different organs, including the nerves, blood vessels, eyes, and kidneys. Gestational diabetes is diabetes that occurs during pregnancy. It occurs in about 4% of pregnant women and carries an increased risk for complications of pregnancy. Diabetes affects the way the body's immune system responds and can increase the odds of developing infections. High levels of glucose can cause infections to develop and spread more readily. Diabetes is one of the fastest growing health challenges of the 21st century, with the number of adults living with diabetes more than tripled for the past 20 years. The global estimate of adults living with diabetes was 151 million in 2000, but by 2009 it has grown to 88% to 285 million. In 2019, the number of adults aged between 20 and 79 was a staggering 463 million people living with diabetes. Additional 1.1 million children and adolescents under the age of 20 live with type 1 diabetes. So this diabetes is of global concern, and we need to do our best to manage it appropriately. Diabetes is a chronic condition associated with abnormally high level of sugar or glucose in the body. It is a metabolic condition characterized by elevated levels of blood sugar. Diabetes occurs with problem of insulin action or secretion from the pancreas. There are two major types of diabetes. We have the type 1 and the type 2 diabetes. The type 1 diabetes is an autoimmune disease, and it occurs when the immune system attacks and destroys the insulin-producing beta cells of the pancreas. The type 2 diabetes is the most common form of diabetes and is caused by several factors such as lifestyle factors and genes, overweight, obesity, and physical inactivity. When you are physically inactive, overweight, or obese, you are more likely to develop type 2 diabetes. Extra weight sometimes causes insulin resistance and is in common with people with type 2 diabetes. What are the symptoms of diabetes? Some of the symptoms are increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the hands or feet, sores that do not heal, unexplained weight loss. Some of the predisposing factors are when you live a sedentary life, when you are 45 years or above, when you've experienced gestational diabetes, or you have a history where diabetes runs in it. So some of the complications of diabetes include, but not limited to, diabetic neuropathy, diabetic ketoacidosis, diabetics affecting your kidney, affecting your eyes, and affecting your liver. Let's look at diabetes and your nerves. Diabetic neuropathy is a damage of nerves in the foot caused by diabetes, where you no longer feel any sensation on your feet. You might have an injury there and you will not really know that something is wrong with you. And then sometimes you see that the wound or the injury does not get enough oxygen into it, and then the wound develops into a gangrene and keeps widening and going deeper, emitting an offensive smell. Diabetic ketoacidosis is a serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones. This happens when your cell don't get enough glucose they need for energy, and your body begins to burn fat for energy, which produces ketones and which now fills up your system. It could also cause diabetic coma, which means that the person might pass out for a long period of time. Diabetes and your liver. Diabetes raises your risk of non-alcoholic fatty liver disease, a condition of the liver that makes it to be fatter. This condition could lead to liver cirrhosis or liver cancer. Liver disease is an important cause of death for people with type 2 diabetes. Diabetes could affect your kidney. Your kidney, we know, has the function of removing waste from the body, balances fluid, and keep blood pressure under control. Kidney could be damaged from diabetes. That means the blood sugar level is consistently high over a period of time. This damages the nerve cells in the kidney, and then problems set in. So diabetes damages your nerves in your body. This can cause difficulty in emptying your bladder, and the pressure resulting from full bladder can back up and injure your kidney. About 30% diabetic patients with type 1 diabetes and about 10 to 40% of people with type 2 diabetes will eventually suffer from kidney failure. Diabetes is the leading cause of kidney disease. About 1 out of 3 adults with diabetes eventually develop kidney disease. Kidney nephropathy, which is kidney disease, affects your kidney's ability to do its functions. And then you see incidences of the person accumulating fluid in the body. If you press the leg or the hands, you see there is fluid in the body which cannot go out of the body because the kidney is not able to filter fluid out that goes out through the bladder. You have diabetes on your eyes. So you have diabetic retinopathy, you have diabetic macular edema. These are all, the risks are increased when you have diabetes. So causing blindness. Diabetes will damage the nerves in your cells, in your eyes, causing blindness. The macula is known for reading, driving, and seeing. So when diabetes causes the swelling of the macula, it is damaged. Therefore, you can no longer see, you can no longer read, you can no longer drive. It's also been noticed that diabetes affects your sexuality. Because of changes in blood pressure, in blood vessels, nerves, hormone, for the men, they may experience erectile dysfunction, where their sexual organ does not stand for a long time during sexual intercourse. And for women, it's been believed could lead to fertility issues for them. Finally, diabetes affects your heart. High blood sugar can damage your blood vessels and nerves that control your heart. And over time, that damage can lead to heart diseases. So these are the diabetic complications. What can be done about it? Consistently monitoring your blood sugar, monitoring your blood pressure, checking your blood cholesterol, changing your diet, making lifestyle changes on what you need to eat, introducing physical activities into your lifestyle, moving more. According to WHO, we as adults are supposed to move at least 150 minutes of moderate or vigorous activities in a week. You need that. You need to introduce vigorous activity, vigorous exercises. And then you must be able to sleep well and to manage your stress level well. If you like our videos, kindly subscribe, turn on the notification bell so that you get our videos as they drop.